We talk directly to Washington lawmakers who represent us here in the central San Joaquin Valley. And this morning we are talking with Democratic Representative from California's 21st Congressional District, Jim Costa, live from Washington, D.C. Good morning, Congressman Costa. Thank you so much for being with us.
Good morning, Liz. As I say, it's always great to be on a great day. Thank you.
Well, thank you again. Congressman, with the federal government now in the shutdown, vital services are being disrupted. We were hearing about the impact on airports alone. Federal workers are going without pay. What steps, you said you're going without pay as well right now. What steps are you taking to see an end to the shutdown and restore government operations?
Well, to begin with, I'm here in Washington, and I, with many of my colleagues, have been pleading with Speaker Johnson to reconvene the House. The Senate is in session, and notwithstanding our differences, we should never, ever shut down government. It's harmful to the American people, to our economy, and to those federal employees who are asked to work with essential services, air traffic controllers, our national parks, food inspectors, without receiving a paycheck. And now the president's threatening to withhold their pay, which is clearly against the law. And the fact is that we've had differences before. It's Congress's responsibility, the House's responsibility, the power of the purse, to sit down and to work out these differences, and so that we can assure that we have a government that is being funded, and we work on the budget. We should be working on the budget right now instead of being home. It is really an abdication of our duties.
Healthcare, as we've been reporting, is at the center of the current debate, including the future of Affordable Care Act tax credits. What's at stake if those subsidies are reduced or allowed to expire, and what steps are you all taking to convince your Republican counterparts that protecting access to affordable coverage is really critical?
Absolutely. And the Affordable Health Care Act nationwide and in my district makes a big difference. Notices are going out this month to people that their insurance premiums will increase dramatically from 200% to 300%. In my district, we believe over 22,000 people who rely on the Affordable Health Care Act will see devastating increases. A 60-year-old couple earning $82,000 a year, their premiums could increase 321%, over $18,000. Family of four earning $64,000 a year, annual premiums could rise anywhere from $2,500 a month, or a 100% increase. This big bill, I didn't call it beautiful, I had another word for it, is taking $1 trillion away from Medi-Cal and Medicaid that impacts our safety net for our healthcare system in this country. We had a workshop with the hospitals in the Valley and the healthcare clinics, and they believe it's going to be hundreds of millions of dollars to their bottom line in the next 18 months on how they try to continue to provide access to care in our Valley hospitals and our healthcare clinics. We just reopened a hospital in Madera after it had to close. So this is really the bottom line for people's healthcare.
Congressman, we're going to shift gears a little bit. The House recently expressed support for designating today, October 8th, as National Hydrogen and Fuel Cell Day. Can you tell us why and how you see hydrogen impacting California's energy future?
Well, it puts all of the possibilities of alternatives for a reliable fuel supply on the table. And certainly, as we look to provide more areas of fuel that Americans need, that Californians need, hydrogen is a source of that. And Congressman Valadao and I are working together on that on a bipartisan basis with other members as well. We need to make sure that we do everything we can to keep prices in line for people who need to get to work and do all their daily activities. And so a reliable supply of fuels for this country and for California are essential.
Congressman, I just heard you mention again that you're working with Congressman Valadao from this area. So clearly folks are working together from different parties. And a lot of people at home may be thinking, again, what is keeping you all from working together when it comes to getting this shutdown handled? And given that you've experienced this before, because you've been in Congress for a while, how would you say this shutdown is different from years past, from prior ones?
Well, in prior ones, we agreed to sit down and talk. You can't work out your differences unless you sit down and talk. And we've implored Speaker Johnson to reconvene the House of Representatives. The Senate is in session right now. And the president even yesterday finally indicated that maybe we should try to work out these issues on the Affordable Health Care Act, on the pending premiums that could be devastating. And the biggest impacts in states, not only in rural areas like the Valley, but are in significant red states. 10 of the largest states that are hit are in the South and in regions where, a lot of the president's supporters are going to feel the pain. So this is not good. And people want to know that their health care for themselves and their families is going to be affordable.
We just saw Representative Marjorie Taylor Greene yesterday saying that now she's ready to jump ship and actually go with the Democrats on this because she realized her kids' premiums are about to go up as well. I think the other question a lot of people have is, as we let you go, final question, is that the Republican side, they are arguing, well, we're just, at least help us pass a temporary bill. We can talk about health care later. Is there a trust issue there that's keeping Democrats from saying, no, let's get this done now?
Well, I think if we were sitting down and there was a commitment to, in fact, work on the Affordable Health Care Act, while we're working on the budget issues, we could cross that bridge. But they're not here. We're here. You got to sit down, and the leadership has to decide, and I think they will sooner than later, because we must, to work out these differences on the Affordable Health Care Act, the pending premiums in which notices are going out that will affect millions of Americans, and to at the same time work on our budget. I mean, we're overdue on our budget. The deadline was October 1. And we need to be working on all of the above. That's our job, and we should be here in Washington. That's the bottom line.
People in their households balance their budgets, and we can only hope that Congress will do the same. All right. Thank you so much, Congressman Costa, for your time this morning and for your work there in Washington, D.C. as well. Great.